Hello, everybody. Welcome to our Facebook Live today. Let me get us set up. Hello, everybody. All right. Well, my name is Danielle Gomez, and I'm here with Charity Laister, the Director of Behavioral Health here at Cahaba Medical Care. Charity is a licensed clinical social worker with more than 10 years of experience in social work and mental health care. She joined Cahaba in 2018 as our Director of Behavioral Health. So thanks for joining us, Charity.
Thanks for having me. I'm excited to be here.
Yes. So for those who don't know us, Cahaba Medical Care is a community-based healthcare organization that aims to follow Christ in becoming an incarnation of love, peace, and justice for our patients on their journey towards physical, mental, social, and spiritual well-being. We offer primary, prenatal, dental, and mental health care across Central Alabama to anyone that needs it, regardless of where you come from or how much money you have. So Cahaba is actually coming up on our 10-year anniversary of starting our behavioral health and social work department. So it's very fitting that May also happens to be Mental Health Month. Today, we're going to be discussing a topic that has become even more important since the pandemic began. It's a word that you've probably heard before in your social circles, on social media, maybe at school or work, but you may not really know what it means. Mental health. So Charity, can you tell us what is mental health?
So mental health is really your psychological, emotional, your cognitive well-being. If you had to think of it, it's truly just the thoughts that you think and your well-being regarding your thoughts.
Yeah, that is a really great explanation of what mental health is. So as many of you know, Cahaba does primary care, which is medical care, but why does my mental health matter to my physical health?
Yeah, so mental health is really important to your physical health. Research has found that mental health impacts your digestive system, it impacts your heart, it impacts your sleep, your overall energy, even impacts your body as far as pain is concerned. And then it impacts your overall just life expectancy.
Yeah, definitely. So that's a really good explanation of why Cahaba, as your primary care provider, cares about your mental health as well. I think we've all experienced when you get butterflies in your stomach, when you get nervous or excited, or you get a headache when you get tired. Like different things about your physical health are related a lot of times to your mental health. So it's really cool that Cahaba is able to provide mental health care when you come in for your annual checkup, when you come in for your well child check with your kids. It's a very unique service that Cahaba is able to provide to all of our patients to be able to take care of your mental health and your physical health all in the same place. Charity, a term that we hear a lot these days is self-care. So what does self-care mean and how can I take care of my mental health?
Yeah, so you can take care of your mental health by truly getting enough sleep, making sure that you're exercising, and making sure that you're taking quiet time each day. If that's meditation, prayer, or truly sitting to just observe nature, that can help. But ensuring that you're getting enough sleep, exercise, and quiet time can impact your mental health in a positive way.
Yeah, definitely. I feel like that can be hard to do sometimes when you have kids and you're busy with them or you're busy with work and just trying to find time to take care of yourself instead of taking care of, just everything that's going on around you. Definitely really important to take some time and do something for you, do something that you enjoy that's going to give yourself a break, make time for rest and prioritizing sleep. Those are not only important ways to take care of your body and your physical health, but also your mental health as well. Um, so a lot of us have heard of conditions like anxiety, depression, PTSD, but we may not know exactly what those are and how common they are in our community. Charity, what are some of the most common mental health conditions?
Yeah, so the most common mental health conditions that we see at Cahaba Medical Care are anxiety and depression. We definitely see PTSD as well, but just depression. A lot of times people think of major depressive disorder, they might have heard of that, but just the general depression that's moderate or mild could look like having a low mood. It's truly a mood disorder where you're in a low, sad mood for a prolonged period of time. And then generalized anxiety disorder. That may look like having racing thoughts where you can't go to sleep at night because your mind is still going. It might be, doing some things that are typically associated with OCD, where you are rechecking doors, concerned, more worried than usual. And so typically at Cahaba, we see a lot of people who have never been diagnosed with a serious mental illness, but are experiencing generalized anxiety or depression.
Okay. One question I have about anxiety disorders is how do you know the difference between just stress and what is an anxiety disorder?
Yeah, so I think that once something starts impacting your everyday life, as far as you're not able to sleep because of racing thoughts, the racing thoughts or anxieties and stress is impacting your work, is impacting your social relationships. It's outside of normal stress. Some stress is healthy and some stress is detrimental to us. Being stressed about making sure that you ace your math quiz that you have coming up is a healthy stress that might push you to study and do things that you need to do in order to get an A. But then when stress and anxieties and worries tend to impact your social relationships, where you're too concerned about things and not interacting with family members or friends that you typically, interact with, or you're too stressed to sleep at night, you're too stressed to do things that you enjoy, now we're going into some generalized anxiety that needs to be addressed versus healthy stresses that push us to do things we need to do.
Okay, yeah, that is a really important clarification to make, a distinction to make, to kind of understand, when is it that this is just normal emotions and feelings that I'm going through as a human being, and when is it something that I need to talk to somebody about and be maybe concerned about and seek some help. Speaking of seeking help, what are my treatment options? Do I have to take medication?
No, you do not have to take medications. And even in taking medications, it's important that anyone who's having generalized anxiety, having depression, that they also include behavioral health treat services. And so that could be, individual counseling, group counseling. It could be just a brief intervention that you meet with someone for 30 minutes.
Yeah, so can you tell us a little bit more about the mental health services that Cahaba offers?
So Cahaba offers all of those services. If you come into, a Cahaba Medical Care clinic just for your well child checkup or wellness visit, your annual visit, and you identify to your provider that you're having depression, having anxiety, you can see a behavioral health consultant that day for a brief intervention after you see your doctor or before you see your doctor. But then you also could be referred for individualized counseling, which could go from 30 minutes, 45 minutes to 60-minute visits that happen over 4 to 6 weeks. And then we also offer some group counseling services for substance use disorders, for trauma, for pain management, and we offer family counseling as well.
That is wonderful that so many of those behavioral health and mental health care services are available at your primary care clinic, at your local neighborhood clinic. I want to remind everyone watching that Cahaba is going to take care of you no matter of your ability to pay. We accept all major insurances as well as uninsured patients. It doesn't matter who you are, where you come from, what you look like, or how much money you have. We're going to take care of you, and that means your physical health and your mental health as well. So just to recap, one of the services that Cahaba offers is behavioral health counseling. So that is on-demand counseling when you come in for your primary care checkup, your diabetes checkup, check your blood sugar, check your blood pressure, whatever it is that you're at Cahaba for, talking to your doctor. You can talk to one of our behavioral health counselors as well as just what's going on in your life. How are you feeling mentally? If you do feel like you are experiencing signs of anxiety or depression or another mental health condition, it's really important to mention that to your doctor so you can talk to one of our counselors as well. And like Charity said, we offer counseling, which is going to be a little bit more in depth, get you on the schedule with one of our counselors, and you can come in for usually over the course of 4 to 6 weeks and talk to one of our counselors for about an hour at a time. Really important to be able to seek that mental health care that you need and be able to live with the best physical as well as mental health that you can. Charity, can you tell us a little bit about our mental health crisis hotline?
Yeah, so during the pandemic, we realized that mental health was a big piece of this pandemic. A lot of people were isolated and becoming depressed. And so we created the mental health hotline at Cahaba, where you can call our hotline, which is 1 507 4402. And you can contact a counselor Monday through Friday, anytime from 8 to 5. We also do some on call services after hours, but you could contact that line to reach a counselor and talk to them that day for de escalation. If you're in a crisis for suicide, homicide, you can contact us and we can talk you through it.
That is wonderful. So just remind us again, that's Monday through Friday.
Mm-hmm.
Okay.
Monday.
Okay, from 8 to 5 Central.
Yes.
Wonderful. And after this, I'm going to leave the number of our mental health crisis hotline down in the comments, so you can write it down. And so next, Charity, we've talked about all of the services that Cahaba offers for mental health, but how can I talk with one of Cahaba's behavioral health counselors?
Yeah, so all of our established patients have access to a behavioral health counselor. Once they come into Cahaba and they're being seen by their medical providers, they can be connected just by asking your medical assistant or your primary care provider for behavioral health services. And a counselor will see you and schedule you to either do individual counseling or follow up with you at your medical visits.
Yeah, so like I said, like Charity said, just talk to your provider next time you're in the office or give us a call. You can call your local health center or you can find the one closest to you at cahabamedicalcare.com/locations. I'll send that link in the comments below as well after this live stream. So just remember, your mental health is just as important as your physical health. Charity, thank you so much for taking the time to talk to us about Mental Health Month this May. If you do have more questions, put them in the comments below and we'll definitely reach out to you and get your questions answered about mental health. So thank you so much, Charity, for joining us.
Thank you.
All right, don't forget to visit cahabamedicalcare.com/locations to find the health center closest to you. All right, thanks, Charity. Have a great day.